Christopher Kramer from the University of Virginia and Associate Editor of JACC Cardiovascular Imaging. And with me today in the studio is Dr. Chun Wan from the University of Washington. And we're here to discuss his very exciting paper that's soon to be published in JACC Imaging on MRI of atherosclerotic plaque composition with lipid lowering in the carotid arteries. Chun, tell us about how you came up with the idea for this study.
Thank you. I think it has been shown in the literature and also with many different groups' work. MRI is a technique that you can actually visualize atherosclerotic plaque composition and also measure plaque volume. So we think that it will be interesting to do a study to look at what is the true effect of statins or other different compounds in terms of what is the time course of changes in lesion composition and visualized by non-invasive imaging. So this is essentially a study based on that concept.
And how many patients were included in the study and how were they selected?
There were 122 patients included in the study, and this is selected based on three populations. One is a population with conformed coronary artery disease. The second one is with conformed atherosclerosis in the carotids, and the third one is with a peripheral artery disease.
And this study that you performed was in particular in the carotid artery, was that correct? So tell us about the imaging that you performed.
Yeah, this is actually the imaging, even though the patients are coming from different sources, the imaging is fully focused on the carotid artery based on a multi-contrast approach that we have developed over the years. And the idea is with this, that we should be able to actually visualize the centered at the carotid bifurcation region, and to look at the atherosclerotic plaque itself, its size, and also its composition.
And what different components can you visualize with your multispectral MRI approach?
Well, we have, in this particular study, that we have actually looked at lipid-rich necrotic core, intraplaque hemorrhage, calcium, loose matrix, in addition to the regular measurements of the lumen size and vessel wall size.
And these patients were all treated with aggressive lipid lowering. Over what period of time were they studied?
And this is another thing that is quite interesting of the study is this is actually we followed patients for 3 years. So there's a baseline 1 year, 2 year, and 3 year MRI scans. So it's overall it's a 3-year follow-up.
And what was the most important finding in your study?
We're finding among the subjects, it's 33 of them actually have a formed lipid-rich necrotic core at baseline. You see the reduction of the size of this lipid-rich necrotic core over this 3-year course. You actually see the changes in year 1, year 2, and year 3. And the rate of this change is slightly different per year. This, I think, is the most important finding from the study, I think.
Tell us about this rate of change. Was it initially faster and then the lipid depletion slows over time? Is that correct?
That's the interesting part. It seems to be that for year 1, it's a faster rate of depletion, and year 2 is rather similar to year 1, and then it slowed down from year 2 to year 3. And what is also interesting of the study is if you look at the vessel wall volume measured from that same segment, the changes of vessel wall volume was more prominent at later years. In other words, the time course of the size change, the plaque burdens change, versus the so-called lipid-rich necrotic core change over that same period is following a slightly different track.
And do you think that's because different components are changing during that later time course, or is it not clear?
I think that actually there are some indications in the study we have discussed in the manuscript itself. If you look at the changes, there is actually a percentage increase of fibrous tissue component over that period. So what that may be indicating is that the lesion is becoming more stabilized. And that truly is the hypothesis we're trying to test with this study.
Well, I think this is very exciting and important data that's showing that lipid lowering depletes the lipid-rich necrotic core and increases fibrous tissue over time, as demonstrated by non-invasive magnetic resonance imaging in the carotid artery. Congratulations on a terrific and very important study, and we're very proud to publish it in JACC Cardiovascular Imaging.
Thank you very much. And we are very excited of having this published. I think it's a very important piece of data, especially for imaging field.
And please look for this paper in JACC Cardiovascular Imaging, and thanks for spending time with us.